Good evening, everyone, and welcome to the last in the current series of our Understanding Mental Health series that we've been running over the last few months. Tonight, I think we've got another very interesting talk on vaccine hesitancy, mistrust, and conspiracies. And we're going to have Daniel Freeman, Professor Daniel Freeman from my department in Oxford, talking to Jon Snow, the renowned Channel 4 news presenter. Sorry, John. I think this whole area of vaccine hesitance is very interesting. And although we started on mental health, I think that in a way it makes a huge amount of sense to me to come to this issue now, because one of the things that's emerged whilst, and I've been involved in the development of the Oxford vaccine, the whole of Oxford has. It's been an incredible period for us. And one of the things that we've begun to understand over the last 12 months is that it's one thing for the Oxford Vaccines Group to develop the vaccine, and it's terrific, and then partner AstraZeneca to do the trials and all of the work that's involved in that, and the involvement of this huge collaborative effort. But actually, there's an awful lot that goes beyond the development of the biological vaccine, and that's where the understanding attitudes and making sure that people are aware of the risks and benefits and the possibility of hesitancy and how different groups can look at vaccines is so important to be able to get vaccines into the population. And in fact, we were just talking earlier on today across Oxford about, okay, it's not over yet, but we've learned a lot over the last year. So what do we do in terms of preparedness about future pandemics? And this whole area of understanding attitudes and the need for reliable information came across incredibly strongly. And Daniel is a remarkable professor of clinical psychology in the Department of Psychiatry in Oxford. We've worked very closely for a number of years. And I'm going to ask him in a minute to start talking about some of the research he's been doing, looking at attitudes to vaccines and vaccine hesitancy. He's a very distinguished clinical psychologist, and a lot of work on virtual reality, and also a couple of years ago presented a series on understanding paranoia, a history of delusions on Radio 4. Jon Snow will be well known as the highly trusted anchor man of the Channel 4 news, and I'll introduce Jon a little bit more when we come to that part of the webinar. Just a couple of housekeepings. We are inviting questions and answers tonight, and if you could post those in the Q&A section of the Zoom, then I will look at those and ask Daniel and Jon to answer them as we go on over the course of the webinar. And if you could announce who you are, that would be terrific when I ask the questions. We do also have access to a live transcript, and that's on the screen at the bottom of the Zoom. So if you want to see the transcript as we go along, then that's a new feature that's available, which may help. So lastly, I'd just like to thank Saffron Weiss and Dora Lowenstein again, and Tom Stutterford, and all the people who've been involved in putting on this series of webinars, particularly Andre Tomlin and the Mental Health, and Sally. We've had a lot of people attending, and it's been a new experience for us doing it in this format, but I think we've learned an awful lot from it. So I'm going to pass over now to Daniel, who's going to give us a presentation on some of his research in this area. Thank you, Daniel.
Thank you, John, and good evening, everyone. Just going to share my screen. So, just over a year ago, a national emergency began, the greatest crisis since World War II. And right from the beginning, we knew that there'd be no way out without vaccines. And I knew absolutely nothing about vaccines. But I had a sort of half-formed notion that the success of vaccines, indeed the success of all the lockdown measures, depended upon trust. Trust to take the vaccines, trust to adhere to the new rules. And trust was something I did know about, because my expertise is understanding and treating paranoia when trust has gone awry. So I thought I could help. And what I want to do now is just share with you where that sort of half-formed notion led. Now, in the early weeks, there were signs of trust failing. So, for example, we had 5G masts being burned. These seemed extreme, rare, anecdotal. So what I really wanted to do at that point was just take the temperature of mistrust. So, how many people were believing these sorts of extreme ideas? I thought it would be a very small percentage of the population, maybe around 5%. And then if there were these people believing it, did it actually matter? And that led to the first Oceans survey. So we did a survey of 2,500 adults in England. We got the data arrived with me at 7:30 p.m. on the 11th of May last year. And I submitted the paper within 24 hours. So that was probably the latest night I've had for a long, long time. We assessed over 30 different conspiracy beliefs around the coronavirus. I'm just going to give you a flavour of some of it. What I will say is that my evening and my night was unsettling, because I was wrong about a prediction of 5% endorsing these sorts of beliefs. So, for example, the idea that the virus is a hoax, 20% of the population endorsed this to some degree. Only 80% didn't agree. And this was pretty par for the course with the conspiracy beliefs, and some were endorsed to a higher degree. So, for example, the idea that the spread of the virus is a deliberate attempt to reduce the population. About 40% of the population was endorsing this to some degree. So this was eye-opening for me. And if you endorse one conspiracy belief of coronavirus, you would be more likely to endorse another, even if they were contradictory. So if you endorse the idea that it was a plot by environmentalists, you'd also be likely to suggest or believe more that it was a plot by globalists. Really what we found is that the content of the beliefs matters less than the expression really of suspicion and mistrust and antipathy to official accounts. Only half the population were not endorsing any conspiracy beliefs. Around a quarter showed a consistent pattern. And it also linked to other conspiracy ideas. So, for example, about climate change hoax. And here's some data about beliefs about vaccine safety and effectiveness data, the idea that they're made up by scientists. Around 20% of the population endorse this to some degree. But I think what's perhaps most striking is that around a quarter of the population are neutral. They neither agree or disagree. They're kind of sitting on the fence. So this is rather worrying. And I think also here you can see the sort of long tail of the fraudulent claims made about vaccines and autism in the 1990s. So I found these data startling. But does it matter? Well, our data suggests it really does, because if you endorse conspiracy beliefs, you are less likely to stay at home, you are less likely to not meet with people outside your household, you are less likely to stay 2 meters apart when you were outside, you are less likely to wash your hands or use a contact tracing app or wear a face mask or take a diagnostic test, and you were saying you were less likely to accept a COVID-19 vaccine too. So these ideas do matter. I think what we've been seeing is almost a perfect storm. So there were clouds building. We knew in the past that people who believed conspiracy beliefs were more likely to be marginalized. This was building up a reservoir of feelings of vulnerability and mistrust. And of course, what we've had for quite a while now is a sort of attacks on facts, undermining of key gatekeepers, and a reliance and spreading of ideas on social media. This is the context in which the pandemic arrived. The pandemic, of course, is a massive event with multiple different threats for people, a lot of uncertainty, necessary imposed top-down change. We had isolation and disruption to normal behavior. So in those conditions, what I think we've seen is conspiracy beliefs move from the fringes to entering the mainstream. Now, when we published that paper last May, the Oxford vaccine developers were already testing their COVID-19 vaccine in humans. And I remember on early lockdown walk thinking to myself, we're about to have a test of trust like no other, whether people will actually accept a vaccine. And I also thought I need to work with people who do know about vaccines. So I fired off a very apologetic email to Andrew Pollard and Helen McShane, vaccine developers. And marvelously, they replied because they too realized the importance about understanding and addressing vaccine hesitancy too. So that led to Oceans 2, the second study, where we focused upon understanding vaccine hesitancy, this time in a survey of just over 5,000 adults in the UK. We did both a survey, but also we did a number of in-depth interviews with people across the spectrum of views of vaccines. Back then, so this is sort of September, October time, what we found is about 3/4 of the population were positive about vaccines. They would get it as soon as possible or get it when they have time. But around 15% were strongly hesitant. So they said they would avoid getting it for as long as possible, or would never get it. And another sort of 10% were sitting on the fence. Now, what really determined where people stood on this were their views on 3 key issues. Most importantly, whether they saw a collective benefit to being vaccinated. So people who are positive about a COVID-19 vaccine would say things like, so I think it's really selfish almost to think, oh, I don't want to get it just because you think you'll be fine. It's about thinking about others and coming together sort of like a community. But people who are vaccine hesitant would say things like, if I then get it, then that's my choice. It's like if I smoke, that's my choice. If I want to shorten my life, because I know smoking will shorten my life. So it's just a personal choice thing. So it's more framed in terms of personal choice for those who are vaccine hesitant. Speed of development, you see a striking difference in interpretation of what this means. If you're positive about vaccines, you see it as a great thing. So you would say things like, to get a vaccine ready in such a short time, frankly, it's quite amazing. It shows how good our pharmaceutical industry is, and I think it's something to be proud of. But speed of development is a real concern if you're hesitant about vaccines. People would say, it's too short a time. I don't think there's anywhere near enough data they've got. And personally, I think they may even know definitely they're using the general public as guinea pigs. The guinea pigs is a phrase we've heard a lot. And then thirdly, there's the degree to which people view the virus as a serious threat. So if you're vaccine supportive of vaccines, you would say things such as, obviously surrounding areas have been bad and the country as a whole has been a mess, a total mess. And it is serious because so many people are dying. Whereas if you're vaccine hesitant, you're more likely to make analogies with it being like the flu and saying things like, I still feel a lot of the figures are wrong because they seem to be putting things down to COVID where they're not all COVID. We know that, everybody knows that. And what we found in our work is that these beliefs about the pandemic and vaccines are really intimately connected with a person, whether they're going to be vaccine hesitant or not. They're very tightly bound. But there's also a contribution, and it's smaller, about 1/3, from general mistrust and trust. So people who are vaccine hesitant are more likely to have negative views of doctors, to see doctors sort of looking down at them, have more negative NHS experiences, have more conspiracy beliefs, and what's called a need for chaos, a wish to see everything kind of torn down. And they were also less likely to have positive views of medicine or positive NHS experiences or with GP experiences. This understanding we took into Oceans 3. What we wanted to do is see whether our learning, we could use that to test out whether messages that address the concerns reduce hesitancy. So this is a large study in 18,000 people. We randomly assigned them to 10 different messages. This paper is coming out in 10 days' time, and I'm just going to give you a sneak preview of one of the main findings. But really what we're wanting to do is this is an issue about messaging at scale. Beyond saying a vaccine is safe and effective, what actually may reduce hesitancy in messaging? Now, we had a very obvious prediction. We very much thought that collective benefit messaging, those sorts of messages we know are associated with acceptance of vaccines, if we could put them across, that they would begin to alter views. So messages such as this: the vaccine makes it much less likely that we'll pass on COVID-19 to other people. So by taking it, we're helping to protect each other, family, friends, neighbours and colleagues. It's all the more important given that some of the people we meet may be especially vulnerable to the virus. But this messaging wasn't the most powerful. What was the most powerful in reducing hesitancy about a COVID-19 vaccine were messages that emphasize personal benefit. So statements like this: we can't be sure, even if we're relatively young and fit, that we won't be seriously ill or struggle with long-term COVID-related problems. Taking the vaccine means we can get on with our life without worrying about what the virus might have in store for us. And if you think about it, this isn't actually that surprising, because if you're vaccine hesitant, you're probably not unwell at the moment, so you're fine. And you're more likely to think, actually, if you've got COVID-19, you're not going to have any bad outcome anyway. But you do think you're likely to have a bad outcome, some side effect from taking the vaccine. And you feel more marginalized, excluded from the collective anyway. So collective benefit arguments for this group are likely to carry much weight. What is likely to carry more weight, of course, is personal benefit arguments that may then outweigh the personal risk fears. We're clearly in a high stakes communication challenge, and one that's going to confront us for many years to come. And we're much more likely to listen to communications from sources that we trust. I think trust is an absolutely vital, invisible national infrastructure. It's a precious resource. And I think, as we've seen, it's in short supply in some areas. It's being tested like never before, and we shouldn't take it for granted. Because trust underlies collective endeavour. I think the vaccination programme is a major example of that. But at a more minor level, I think you can also see it at play in the oceans work. Because all these researchers, most of them who didn't know each other, came together in a spirit of trust and for the common good to work in their spare time on the ocean studies. So what I want to do is finish with is by saying thank you to them.
Thanks very much indeed, Daniel. Very clear. And it's great to see such large scale research being done in this area, and the pace, you know, kind of is in parallel to the kind of pace that we've had to do in all the areas of research that we've been doing over the last year. And you know, in some areas we had a degree of preparedness. So the vaccines group, you know, they kind of understood that vaccines is what they do, and these pandemics occur. So we know that they were prepared in a way. But I think, as you were just saying at the beginning of your talk, that this started from zero. I mean, and this is the point about preparedness, actually, for if this happens again, is that we need to learn from what's happened so that we can act much more quickly to, you know, and not make some of the kind of the mistakes that we might have made over the last year. And you know, there's been sort of bumps along the road. What I want to do now, though, is to introduce John Snow. I'm sure that John Snow is well known to everyone. I mean, certainly over the last year, the first thing I've done in an evening is see what time it is. If it's coming up to 7 o'clock, I've turned Channel 4 News on. If it's 7:30, I've waited for the rerun that they thoughtfully provide at 8 o'clock. And for me, it's become absolutely the go-to show. And I mean, I say that even if John hadn't been here with us this evening. And I think we owe an enormous debt of gratitude actually to John and his colleagues, because in this time of huge uncertainty, when there's all these facts and concerns and worries flying around, these trusted news resources become so important to us. And turning on and seeing John and his colleagues in the evening with that authoritative, questioning, fair, balanced approach has been hugely reassuring. And thank you so much, John, to you and your colleagues for keeping doing that. John's been the main anchor of Channel 4 News since 1989, and he's won huge numbers of awards over that time. But he also does a lot of other really exciting things. Like I learned this evening that he is I think it's the chair of UK Cycling, John, which I'm fantastic to hear. And also you continue to be involved in the New Horizon Youth Centre, which is Lord Longford's day centre for homeless and vulnerable teenagers, which I think was one of the first things you got involved in early on in your career, and you've continued to do that ever since. So again, thanks so much for joining us this evening, John. And I don't know if I can pass over to you now to respond to Daniel's work and some of these issues, and then we can go into the question and answer. Oh, I think you're on mute, John.
I've seen a very stark contrast between the approach that Daniel and his team have made and what you'd find if you tumbled into our newsroom. Because our newsroom, I think, is obsessed with the view that an enormous amount of anti-vax activity is courtesy of the web and an enormous number of sources of people either exchanging views with no evidence or indeed peddling. So I just wondered, I mean, how seriously you, Daniel, take cross-fertilization, if you like, on Facebook, Twitter, and all the other social networks, on which there are, of course, hundreds, millions of people exchanging views.
I think is absolutely crucial. Andrew Chadwick, a political scientist, has been working in Ocean's team and has found some really interesting data from our work. So there are people who get their news just from social media. There's some people who get it from mainstream sources such as yourself. There's some people who are avoiding getting any news. There are others who sort of multiple sources, but the whole range of different sort of media diets, he calls it. And what's interesting is that the two groups who are more likely to also go on social media and discourage people from taking vaccination are either those who get their news from social media and have a sort of conspiracy sort of mentality, really, or those who are avoiding news completely, but kind of relying on their friends for news. So I think, and I've certainly heard it from interviewing people, a lot of information coming from standing outside the school gate sometimes, talking to other people, and then also from social media. So I think it's a huge part of the spreading of misinformation and also undermining trust in credible sources. And I'm sure you must have experienced huge pressures from social medias coming your way.
Yeah, but it is interesting. I mean, we hacks, if you want to put it that way, are affected by each other's work to some extent. And there was a very brilliant piece the other day in the Financial Times in which they took 3 very poor boroughs in East London and they found a universality of deprivation, crowded housing, I mean, all sorts of conditions which would obviously produce outbreak, irrespective of what is being done to try and vaccinate them. Although there wasn't much evidence in the article that those 3 boroughs were benefiting very strongly, given the density of housing and the rest of it, which might have made them a top priority. They didn't appear to have been so. And what I've wanted to do as a journalist on television is to take a map of poverty and deprivation in Britain and then lay another map on top of it, demarcating the shape of the outbreak. And I'm absolutely convinced that the two are deeply entwined, and that deprivation is a huge. Now, enter into all that your arguments about the extent to which conspiracy theories and all the others are playing anti-vax games with us. Is that actually as destructive as the way in which our society is configured? And isn't that, in the end, the biggest reason why the outbreak and indeed the reaction to it is delineated?
Yeah, I think what we're seeing is the consequences of splinters in society, and it plays out in physical and in mental health. And I think it's revealed when we have a crisis that often these things chug along in the background, but they're hugely important. What I would want to get across, though, is in terms of vaccine hesitancy and conspiracy beliefs, there are some associations with socio-demographic factors. They're clearly there, but they don't explain a lot of it across the population. These conspiracy ideas, but also vaccine hesitancy, could be anyone. It is slightly higher in younger people. It's slightly higher in women, slightly higher in those of lower income. It's slightly higher in minority groups, and within those groups, it can be quite particularly high, but it doesn't explain all these socio-demographic factors. It doesn't explain the majority of vaccine hesitancy. It's spread far and wide, I think. But you're absolutely right. It is. We see the consequences in a pandemic of decades of issues, I think.
I was interested by your findings of those that support conspiracy views. And 50%, is that what you anticipated, or did it come as a shock to you?
Yeah, I study paranoia, so I've done a lot of work in the general population looking at the levels of paranoia, how much people think they're personally targeted. So I've been immersed in that literature. But it was actually really grim getting the data. It was far worse than I expected, and some abhorrent extreme views are held by a significant minority. And yeah, I was shocked and disturbed, and I am worried about it. I think it needs addressing. It doesn't, when you see those sorts of ideas, it doesn't make you think well of the health of the nation at that point. There's lots of good things going on, and I think what's important, I think, is that the majority are in favour of vaccines. The majority do see collective benefits. There's lots of good things, and there's, but there also is a degree of concern about what this reveals, really.
I suppose there's no data from 1918, but one does genuinely wonder what the access to instant communication in the form of a social network, what role it's playing in stoking some degree of skepticism and perhaps worse. I suppose nobody has looked back to see whether anybody tried to do any work in this regard all those years ago.
I don't know, but I think obviously what you've also got with social media is the potential for state actors as well. So you've got lots of people stirring up, and misinformation is obviously spreading. That also can be an attack on something, the vital it is in effect undermining a key part of democracy, where we need information and facts, and you can see this there's both sort of individuals for various reasons spreading stuff, but also you've got things being stirred up by certain nations too, and of course that couldn't have happened in the past.
How do you test trust and mistrust?
How do you test it? Well, clearly we are testing it now, but in terms of finding out where people are, we always in the end have to ask people, and then we can also look at behaviours. So all the sort of vaccine hesitancy work is about what people are saying they're going to do. That's not going to be a perfect match to what they actually do, and we know a key driver of vaccine hesitancy is simply of acceptance is simply following what other people do. So there's no doubt that people can be hesitant, but because everyone else is getting vaccinated, they just do it because it's the norm. So asking people is really informative. It doesn't always correlate with behaviours, but there is a connection. But in the end, with mistrust, we tend to have to ask people. We have various ways of doing it. We have, in our scientific work, we have various sort of scientific paradigms to assess it sort of in the moment. But in terms of large scale, taking the temperature, we ask people in surveys typically.
We've got quite a few people on with us now from Canada and various other parts of the world. And I'm just wondering whether you think that what you've produced is peculiarly British, or probably an indication of most countries in our sort of echelon of economic development. I mean, what conclusion do you draw from it? That there's something unique about vaccine hesitancy here, that it's worse or better than in comparable societies elsewhere, or does the information simply not exist?
No, I mean, I think that the findings fit with what we've known about vaccine hesitancy in the past. Typically, it's thought about in terms of confidence, whether you think a vaccine is going to work and whether it's safe. And those are the same issues coming up here. And also there's a concept of what's called complacency, is whether you think it's actually needed for the particular problem. So our findings certainly fit the general framework about the understanding decision making here. What we've probably built in more from our work is the role of sort of general mistrust and marginalization feeding into it. I think you can see similarities in a number of countries. I think in some countries it's more politicized than it is here. But generally the framework, I think, applies. There's going to be differences. And I think the issue about messaging is going to vary probably to some degree in countries and at particular moments in particular times. And there's certainly evidence that when waves hit and people realize what's going on, then you can see an increase in acceptance. What I would also say is since December, we've seen a big increase in vaccine acceptance in the UK. I don't know how much that's been affected by the current stories, but we've seen a large jump from the start of the vaccination program. So I think it's gone well.
Well, that is particularly interesting because it would seem to me that that jump could not have occurred unless a sizable number of doubting Thomases actually switched horses at the last moment.
Yeah, I think there has been. I mean, I can hear that. So I think that's really important that I think sometimes people who are vaccine hesitant sort of thought, well, we just leave those people alone. But actually, what I found is, of course, they've been thinking long and hard. And actually, it is possible for views to change here, which is incredibly interesting. One guesses that sometimes that hesitancy made the ones less deeply rooted in suspicion and mistrust. But there's no doubt that for many people, their concerns were simply the trials haven't been carried out for long enough. There's going to be some side effects that emerge. I want to wait 6 months. And those people, I think, have switched. But we've certainly seen some people switching, which is encouraging.
There's a sort of clash, therefore, between herd immunity and herd dash for the doors and pick up the vaccine.
Yeah, I mean, the main mistake of the vaccination, the more people do it, the better. And I think that's the end. We don't know what percentage you need to achieve herd immunity. It's very complicated. It depends on the variants and the vaccines and who gets vaccinated as well, their own behaviours. There's multiple factors, but we need a high acceptance rate clearly to have the most effects. We're doing pretty well in this country, I think, which is good news. But of course,
if your figures are right, then there is going to come a moment, well, within a year, I'd have thought, where you will begin to see specifically a large group of people who simply won't take the vaccine, and still lots of vaccine available. And therefore, I'm wondering what happens then.
Yeah, and it's absolutely important we don't isolate these people. I mean, I think we have to anticipate that, and we have to go and listen to concerns. And and then address them properly. We need to be out across the country, listening to concerns and compiling them. And I think it is hard to find really accessible, good information. It's very hard to find information that's particularly sticky in positive vaccine as opposed to sort of scare stories. So I think we have to anticipate that. And we don't further marginalize the people who are in that moment still taking that position. We're going to need to listen to them and try and address their concerns.
Do you think the youth of the vaccine, i.e. the fact that it's been invented so recently, I mean, I think it's 9 years, is it, sort of since the first major coronavirus vaccines were in mass production in any form? Do you think that affects people's doubts?
Absolutely, hugely. And from one of the slides I showed, what understandably was a central message at the beginning of the pandemic was, don't wait for a vaccine. It's going to take ages. You can't depend on it. These things take a long time. That message was heard. And then unfortunately it's heard, well, somehow it's happened anyway. So that's a bit suspicious. And then I think also people are thinking sort of analogies to other types of medical interventions in terms of trials, where of course the way vaccines work tends to mean if there are going to be common serious side effects, you'll know about them soon, just because of the mechanisms about what vaccines do, which is different from other treatments. So what has always interested me, and it was particularly looking at the vaccine data, thinking about how little I knew about vaccines, and my experience was as a kid standing in a queue, having a vaccine, not really knowing what it was for or what it was about, and that was it. And I think there's a huge opportunity here, also with interest in this, just to provide a lot more information and education around this, which I think would change things. There's a real opportunity now. People are really interested. Whatever people think about vaccines or whatever along the spectrum, they're desperate for information. This is a real chance. But of course, we could have been doing this a long time ago, because they're so important. They're remarkable science, and actually so many of us are not as well informed as we should be.
But you see, the information that became available about AstraZeneca, which was that out of 18.1 million doses, 17 people had died. I mean, and even then you couldn't be absolutely certain they died specifically because of something to do with the vaccine. But the very fact that these numbers were out there, despite the utter improbability of you dying as a result of having a vaccine. And I mean, I can't even give you the percentage, the sub-zero almost, the percentage chances. And yet it has been immensely damaging.
Yeah, I mean, I think any adverse events from medical interventions are a tough thing. And I think it is serious in that way. However, what's really important here, as you're highlighting, and there's research from the Department of Psychiatry here, shows actually these sorts of medical events are more common, much more common, if you get COVID. This is about balances of risk, and as you're highlighting, the side effects are extremely rare, certainly the serious ones. Whereas the risks of getting COVID and it being spread, all of that is far higher. So it's an interesting way, I think, really, is how does that actually get presented on news? I mean, what do you do? It's obviously important people are informed about risks, but people find it hard to judge. As soon as you're told about a risk and you can imagine it, there are various psychological processes in the brain that actually leads to it being estimated generally is more likely to happen than it actually is. People struggle with particularly those sorts of dealing with those sorts of odds. So what I would say is, of course, when there are side effects, we need to know about them, needs to be researched. When they happen, it's a terrible thing. But of course, the risks are much, much worse from not having the vaccines.
Now, I suspect that we've hogged more time than we were actually allocated.
Brilliant timing, John. I was just going to come in and start asking some of the questions. But
I want to thank Daniel very, very much for allowing a completely ignorant man to cross-examine him. But I have learned a lot from him, and I'm going to hand over to you, John.
Thanks very much indeed, John. I mean, just on that issue about, and I think a number of the questions are going to focus on this, actually. I've been watching them come in, but that issue about the effect, this venous thrombosis in the brain occurring, which was a huge risk, and we'd been looking at that big American data set with my colleagues in the department, Paul Harrison and Max Take and Masood Hussain. And we suddenly thought that actually no one knew the instance of that particular adverse effect in people with who'd had the illness themselves. So we were able to look at that in a data set and found it was at least tenfold increased in those people who'd had the illness. And I think that that's one of the things that emerges actually, is that the problem is that the emergence of evidence, scientific evidence, is a bit bumpy, and there are uncertainties about it. And trying to message it too much or make it too clear means that you tend to smooth over the edges and the real uncertainties, and then you start actually spinning it and you give the wrong indication. But what I'm really interested then, and I just want to come to one of the questions on this, because I think this pertains to this, and it's about what is the relationship between media and scientists. Let me see if I can find the exact questions that I can read it out so that I'm not putting my own spin on that one. If you just bear with me for a second. Yeah, so here we are. Yanina Z has put in the questions. The media coverage is definitely to blame. Changing recommendation and keeping quiet on specific questions does not help to build trust. It only makes more people believe they're being lied to. And I don't know if you'd just like to comment on that, Daniel, maybe first, and then John. What is the, from your experience, what's the best kind of interaction between scientists and media in terms of getting the right message across, or the most helpful message across?
So I've certainly heard that people, if they hear spin and they don't hear a sort of full story, don't access it, they do get suspicious. So I think one has to present it, but I do think obviously we have to be very careful in presenting some of the rare risk information. We need to find the best ways to present it so that people can get the best from that information. But I've also seen some very good coverage in the media of vaccines too, I think, and some of the coverage I think has been impressive. But I've been intrigued to know how John has been handling this in the newsroom.
We're fortunate to have one or two specialists who do more or less nothing else, and they have good contacts, and I think tap them very well for information. But the vast majority of us, like me, for example, who may have to carry out program interviews, it can be a bit of a struggle. But on the other hand, if the viewer is going to pick anything up, then the best thing is for them to feel that you're with them in trying to find out what's going on. I think the moment your own ego gets in to try and say, well, of course I know all about this and I've been reading up on it and all the rest of it, that doesn't help at all. The big thing is in some way to engineer a situation in which the scientists can give a raw, honest assessment in answering a very direct question that emerges either from a film or from a panel of individuals, whatever.
That's really interesting. You're describing a stance a bit like we do as psychologists. Really, you want to take the stance of the other person and understand it, and bring in curiosity. So that's a very interesting to hear that style. But I think obviously one of the difficulties is if you present risks, then it's ideal, I suppose, psychologically, to present the other side of that rather than it's just low, but also like the Oxford information John said, almost we need to present that at the same time. But often for people to be well informed, they need that side, but they need to be both presented appropriately. So that must be a huge challenge.
Thanks so much. There's a question here from an anonymous attendee, and I think this is a really interesting one about how much influence does the number of vaccines available and the different efficacies affect vaccine hesitancy? Because we've seen quite a lot of that over the last few months, and there's been sort of this competition between different vaccines, almost.
Yeah, I haven't heard it come up too much. Occasionally, someone has certainly said, yes, I don't know which one, and I don't know whether I get the good one. And you know, there's some people are concerned about that. I think in terms of uh, the number of doses and things, availability, I think certainly, I've certainly not heard too much about that really, but I think there's some awareness about the different types, but I haven't seen that driving the hesitancy. Certainly in some other countries, there's some data showing it depends sometimes a bit about where the origin of the vaccine is from, with more hesitancy about certain countries than others.
My experience in going to assorted vaccination centres is that people discover it is either Pfizer or AstraZeneca, and there might be an initial moment where they say, "Oh, I wish it was Pfizer," when in fact it's AstraZeneca. But to be honest, they're thrilled to get any one of them. There's just a little hesitancy because of all the discussion that I mentioned earlier.
Yeah, I think actually since recent events, I think that's probably right. Yeah.
So I've got another anonymous attendee who's saying it seems that misinformation and distrust are generally tackled through education, transparency, and the dissemination of more information. But the question is there information that it would be advantageous to withhold? And I guess that in this context is, would that have an effect on trust and vaccine hesitancy? Do you censor the information you give out?
I think not, but I think obviously what one wants to make sure that one, when presents information, that one's ready to present it accurately and well. And I think that's a reasonable thing to do.
Thank you. I mean, a question that we've sort of touched on, but I think it just gets at another sort of angle on this. Is much of the conspiracy and mistrust as a result of the media coverage on COVID-19 rather than the source, i.e. the research produced and the clinicians themselves? And if that's the case, does the UK media have a duty of care to ensure accuracy and legitimacy in what they air or publish? And if so, how as a clinical community can we support this? So I don't know, John, if you could perhaps have a go on that first, and then we'll come over to Daniel on the clinical community supporting it.
I genuinely think that most journalists covering this issue do feel they have an obligation of care and care in getting the facts and the rest of it. Whether we, you know, I think we'll all review what's happened and wonder where we went wrong and how we could have done better. But I think we do the best job we possibly can. I think it still is the online unregulated world, which we bask in on one level, but which is to blame for an awful lot of difficulty.
I was thinking that John is the visible national infrastructure of trust. And, you know, I think as scientists, we are very keen to support how we can.
Yeah, I mean, I have to say that one of the things, I mean, we were sort of feeling this anyway, but over the past 12 months, the kind of the camaraderie and teamship that we've developed with organizations like the Science Media Centre, where we can go and talk to groups of journalists and have interaction and talk about questions and, you know, face the curiosity of the journalists to try and find out what the answer is, what the questions are, has been incredibly valuable to us. So it's that interaction. We're sort of all involved in it, but we're trying to work out, you know, how best to put it across and what the current state of the evidence and the science is. There's a question here, it'd be very interesting, I think. So this is from Simon Bacon. It's a key element around the impacts of the risks related to the AstraZeneca vaccine has been the constantly shifting position of, and he's put here the government, because I think he's talking from Quebec, so it's particularly in Canada. But of course, this has been the case across many countries. I mean, we've seen recommendations from government shift all over the place, particularly with regard to that vaccine. So, for example, he says here in Quebec, we went from those under 65 not getting it to those under 55 to those under 30 within the space of about 2 weeks. There were no new major changes in the evidence during this period. We saw this translate to a diminishment in trust in the government, an increase in anxiety and frustration, and a greater creep in seeking alternate information sources. Prudence in evaluating risk needs to be balanced with the impact of poor communication from governments. Government communication might be slightly beyond our control, but it'd be just interesting to get your view on that.
I mean, I think it's been incredibly unfortunate. And we know a key determinant of vaccine acceptance is trust in government. And where places where there's less trust, you're going to see more vaccine hesitancy, understandably. And I think those sorts of messages have been very unhelpful.
I think I must say that in covering the vaccine situation, we have turned, whenever we possibly can, to the medics and not to the ministers. I think we very rarely ever interview a minister about the pandemic. It's not an intelligent route.
That is, I mean, Rachel Baker's asked, what are the best communications channels to combat vaccine hesitant or anti-vax beliefs? Understandably, it is highly reliant on trust. Therefore, is it the media? Should it be the government or the NHS? So building on what you've just been saying, John, that conversation between the scientists and the trusted broadcasters and journalists seems to be something that's really emerging out of this whole episode as something really worth building.
I can only really speak from our own experience, but I can tell you that our health correspondent, who I think by her own admission would say right at the beginning of all this, didn't know much about vaccination, etc., has really built a fantastic relationship of trust with people in the profession, inside the NHS, and inside some of the manufacturing and the rest of it. But she has not spent much time in Whitehall.
It's really interesting as well, because often as scientists and academics and clinicians, we're kind of encouraged to go on media presentation courses, because we know that it's important that we do get our message across to the public. But in a way, I think one of the things that's emerged from this is that it's the conversation between the communications experts and the people who are really good at kind of getting to the bottom and putting it across with the scientists. So the work is around that interface, actually, between the people who are specializing on the science, and that's their job. And they're not going to be kind of media most of the time. They're not going to be media personalities, and the people who are expert in communications. That is where the real kind of value has come across.
There have been some absolutely tremendous performers from, the health industry, the health side of life. I mean, John Bell, the wonderful woman up in Glasgow. There are endless really good people who have surfaced and have been solid and dependable and usable, and have made themselves available. And all those ingredients, I think, add up to a better conversation than any other you can have.
There definitely have been some stars, and of course in Oxford we know John Bell very well and are aware of his amazing strengths in terms of communicating, and he certainly has been exceptional, I think, over the last few months. Let me just have a look. Oh, this is an interesting one, Daniel. How much of the hesitancy around vaccination is related solely to the COVID vaccination rather than vaccines more broadly? So is there a kind of specificity of vaccine hesitancy?
Yeah, to a large degree, and exactly the point that John Snow raised, it's the speed of development issue. There are obviously, there is a degree of overlap but there is a specificity for this. It is a unique situation, and the speed of development is the one that people have been particularly fixing upon. We knew in the past that vaccines that are a bit newer raised a bit of skepticism, but this, of course, has pushed that. So in that sense, it's spread more widely, and certainly lots of people who are only concerned about this one, and certainly have had other ones, and would take a whole range. It's the speed.
Thank you. Another anonymous attendee. What about this one? The very term anti-vaxxers turns people more hesitant. It's about civil and respectful discourse around COVID solutions.
I think it's fundamental. I mean, you've got to respect people's decision making and how they're doing, and listen. And my experience is people have thought long and hard about this, and the only way we will reach more common ground is by listening and respecting others' views. And I think the term isn't helpful, and that sort of splitting in that way is going to embed the problem more. And I think we can see that already from issues around marginalisation as well. So if when you do want to change or find more common ground, just labeling people and arguing with them never changes minds. It pushes people in the other direction. We see so many examples of that. John's more curious stance of trying to understand and respect seems to me the absolute way to go.
I agree with that, Daniel, very strongly. I think you're absolutely right.
I've always found it, I think the other thing actually is this curiosity thing, is that I've always found it an enormous privilege as a researcher to be able to hear the questions that people come up with and to be able to go away and research them. I mean, that's sort of what we did with that risk of CVT, CVST. It was emerging as a concern, and it's in my clinical research, it's terrific to be able to get the sort of queries from patients and see if you can answer them and take them seriously. I mean, that has to be one of our most important jobs, doesn't it, really? That's where the concerns come from, and we should be trying to answer that. And I suppose that, I mean, the other thing is we're not immune to those worries and concerns ourselves. I mean, I went along and got my vaccine, and I was, just checking my blood pressure and things afterwards. And Daniel, a question here from James Gerd is, in reading through all those data, did you doubt your own beliefs about the coronavirus or about the vaccines at any time, or did you remain steadfast in your belief in the vaccine?
Yeah, I was steadfast, which I guess is interesting, isn't it, about how people read decisions. I mean, I was unsettled and unnerved by reading their data, is impression, but of course that's against the backdrop of very much believing in science and medicine and all those sorts of things. I was.
Thanks very much.
Unsettled.
Look, I think thanks very much to Daniel and John. We better draw it to a close at this point. It's an incredibly interesting area, I think, and we've kind of scratched the surface, and actually the pace of questions has picked up as we've gone on, as is quite often the case with these webinars. But so I just want to thank again John and Daniel and all the audience for coming along and asking such interesting questions tonight, and actually to everyone who's participated in all our webinars, all 6 of them we've held over the last few months. And again, to Saffron Weiss and Dora Lowenstein for supporting this, and to Andre Tomlin, the mental health, for facilitating it, and to Tom Stutterford for sort of keeping us on track and making sure that we're in reasonably well prepared and we know how we should be thinking about running them. So thanks to everyone again for it. And actually, one of the things I would just like to say is that I'd like to thank all those philanthropists who have donated to Oxford across both the vaccines program. A lot of Daniel's work was funded by philanthropic funding that came in. it is so important, because it means we can act much more quickly than having to go to a funder to bring money in. And even that initial funding is so important just to get these ideas going. So thanks to everyone who's contributed so far. We make really good use of any funding we come in. And if you do want to give any more, that's absolutely fine. I think Andre stuck the URL into the chat. And on that final note, and I've done it at last, ask for money at the end of one of these webinars. But thanks so much to everyone again, and have a great evening.